my 360. And then floor, and then ceiling. And that's my videographer. My name is Heather Daniel. I'm in the nurse practitioner program at Auburn University. Before starting this assessment, I would have performed hand hygiene. This is my patient Heath. He's a 31-year-old male. We took his vital signs earlier, and they are all within normal limits. Okay. When Heath walked in, I made note of his gait. I made note of his appearance. Any smells coming from his body, like alcohol, fruitiness, cigarette smokes. He was in no physical distress. He appears to be healthy. He doesn't look malnourished, and his BMI doesn't indicate that either. He has appropriate color for his race. He doesn't, I don't know any, the skin that I do see, I don't know any open wounds. Can you tell me your name and date of birth?
Heath Daniel 8189.
What city are you in?
LaGrange.
What year is it?
21.
And who's the president?
Biden.
Okay, so he's alert and oriented. He knows who he is, where he is, and when it is. Again, we're going to first just look at his scalp and head, and we're going to know any lumps or bumps, bulges. We're going to look at the distribution of his hair. The color of his hair, it's blonde, it's clean. We would know any greasiness or brittleness if there were to be any. We're going to palpate. While we're palpating, we can also look for infestations or like dandruff or anything like that that could be made note of. But from the eyes view, I don't see anything that's abnormal. Heath, if you tell me if there's anything that's tender.
Oh.
Okay, and his hair feels soft, it's clean. I don't know any lesions, infestation, lumps or bumps. Then going to move on to looking at his face. It is symmetrical. I don't notice any facial drooping. He's not slurring his speech or anything like that. I'm going to start by palpating. Since we looked at his face, we don't know any lesions or anything like that. Hair distribution along his beard, his eyebrows and eyelashes, and they're all equal and full from side to side. Okay, I'm going to palpate your frontal and your maxillary sinuses. If you have any tenderness, you just let me know, okay?
No.
Okay, we're also going to percuss these. Okay, and that's fine. There's no consolidation or anything noted. I'm going to have Heath smile, frown, close your eyes tightly, show me both your teeth and your bottom tooth and your front tooth, and then puff your cheeks. Okay, that's testing for cranial nerve 7 and it's intact. Heath, I'm going to have you clench your teeth and I'm going to feel behind your ears, right here. Okay, clench, right before your ears. And that is checking to make sure that the temporal and master bone, muscle are intact, and that's cranial nerve 5. Heath, I'm also going to feel right here and have you open and close your mouth. Okay, and there's no crepitus to note, so that's a normal finding. I'm then going to move on to filling his lymph nodes. Pre-aortic, post-aortic, occipital, parotid, tonsillar, submandibular, submantle, pre-cervical, down the chain, post-cervical, and supraclavicular. Did you have any tenderness?
No.
And I didn't know any swelling or lumps or bumps. While we're looking at his face, we're going to look at his eye. We would look at them bilaterally, but for the purposes of this video, we're only going to do one assessment, so one eye, one ear, one arm, one leg, that type deal. We would make note of any swelling, discharge. If there were discharges in any of the ears, wounds, eyes, mouth, we would make note of consistency, color, how much, where and where it's coming from. I don't know any puffiness, no drainage. His eyebrows are equally, hair is equally distributed. There's no drainage coming from his eye. His eyelashes are fine. I'm going to pull down his lower lid, and I'm going to look at his conjunctiva. It's pink. His sclera is clear. His iris is blue, and his pupils are an appropriate size. So that's the external eye. We're then going to move on to looking at the internal eye. We are going to be looking for the optic disc, the macula, the centrioles, arteries, and vessels. So what we're going to do is we're going to turn it on. We're going to check light. Heath, I'm going to have you look forward. If Heath were to have on glasses, we would have them take them off. We would also dim the lights at a regular setting. So we are going to find the red light reflex, and then we're going to zone in and see if we can pinpoint those landmarks. And for his left eye, I'm going to use my left eye and left hand and stabilize. Okay, everything appears to be intact for the things I called. Sorry. Moving on to the eye, we're going to check visual acuity, which is cranial nerve 2. We will use this little chart. It's normally supposed to be 6 feet away, but for the purposes of this video, we'll use about 14 inches. Heath, I'm going to have you cover each eye one at a time and then uncover both, and I want you to read the line that you see best.
LTFPH.
Okay?
LTFPH.
Okay.
LTFPH.
Okay, he's 20/20, and that's a normal finding. That's cranial nerve 2, if I didn't already say. We're also going to do the confrontation test. Heath, I'm going to have you cover your left eye, and you're going to tell me when you see my finger, okay?
No.
All right, now switch.
No.
Okay, and that's also cranial nerve 2. We are going to do cranial nerve 3 and 2, and it's her pupils equally reacting to light and accommodation. Heath, I'm going to just have you look straight. I'm going to shine light in one eye, and both eyes should constrict. All right, look forward, just look straight. Just look at my shoulder, okay? And they do. Okay, now follow my pen light. And his eyes cross, and that is appropriate finding. And again, cranial nerve 2 and 3. We're then going to test cranial nerve 3, 4, and 6. Okay. I'm going to have you look straight, don't move your head, and follow my pen light. And we're going to do 6 points of gaze, okay? Okay. Now I'm going to have you cover one eye. Okay, now the other. Okay, and make both of them right. And now we're going to look for the corneal light reflex. I'm going to shine the light kind of at the bridge of his nose, and it should appear on the same spot on both the eyes. Look straight. And it does. Okay. Going to move on to looking at his ears. So with the ears, we will look at the pinnae and the auricle and the external ear from what we can see from here. This would be a good time to assess for any skin cancer lesions, any drainage again. Make note of that. I don't note any flakiness, swelling, or anything. If you palpate, it should be easily moved, like not stiff, not painful. Is it painful? Okay. We're going to look in this ear. And what we're going to do is we're going to hold the pen light, and we're going to look at the internal ear canal, the malleus, the tympanic membrane. It should be clear and gray. There's, again, infestation, we would make note of that. Make sure nothing's perforated, and make note of any drainage if we were to see or any redness. So I'm going to rest. I'm going to insert gently. And the conal light as well, we're going to be looking for that in the internal canal. We would note any sebum, how much. And up and back for adults. Okay, everything's good. The tympanic membrane's intact. It's gray and clear. It's perfect. While we're looking at his ears, we're also going to test cranial nerve 8 with 3 different tests. One is the whisper test. We would normally do it on both sides, but for the purposes of this video, we'll just do one. So Heath, I'm going to whisper 3 words, and you repeat them back to me, okay?
1, 2, 3.
Okay. It's cranial nerve 8. Weber test, Heath, I'm going to strike the tuning fork, place it on the top of your head. You tell me if you hear it, stop hearing it left, right, or both, okay?
Both.
Okay, so that's a normal finding. If it were to deviate, it would be a conductive hearing loss. I'm going to place it on your bone, and you tell me when you stop hearing it. Then I'll move it to air, and you tell me when you stop hearing it, okay? Hang on. There we go.
Now.
Okay, so air is longer than bone, and that's a normal finding. Again, all 3 of those were cranial nerve 8. I'm now going to step back. I'm going to look at Heath's nose. I would know if any deviation of a septum. I would know any lesions, if he were like an adolescent, maybe pimples and stuff like that. Is everything intact? Is there any swelling? Is there any drainage? And there's not. They're gonna look inside. We're gonna look at the mucosa, the turbinates, and the sebum. Bobby, lean back, okay? Take a good look in. Everything looks good. It's pink, moist. I don't know any drainage or anything like that. Then gonna move on to looking at Heath's lips. Again, look for lesions, the color. If he were to be in distress when he walked in, we'd have made note of that. His lips could have been blue, we don't know. He could have lesions, we would make note of those. Are they pink? Are they moist? Does he look like he's dehydrated or anything like that? Heath, I'm gonna have you open your mouth for me. Okay, can you stick your tongue forward? Okay, as wide as you can. Okay, so with this, we're gonna we're gonna look at we're looking at his teeth, his gingiva, his hypoglossal plate, his posterior pharynx, tonsils, and uvula. To look at the uvula, we need to, and just stick your tongue out. To look at you got the small, I'm sorry, his gag reflex is intact, cranial nerve 10. Okay, and say I. And the uvula moves, so that's cranial nerve 9. Sorry. Again, moving down, we'll look at his neck. We would note any goiter type situations, that there could be thyroid issues. Is the trachea midline? Do we note any bulging, any jugular vein? You probably couldn't see it at this point, but in some patients you might. Hair distribution, any lacerations, open skin, or anything like that. We're going to palpate his trachea. And it's midline. And come around back. I'm going to have you swallow for me. His thyroid is intact. His thyroid gland is intact. Also, Heath, can I have you stick out your tongue? Move it up and down, side to side. Okay, and that's cranial nerve 12. Also, can you move your head side to side? Can you shrug your shoulders for me? Okay, and again, push against me, and back, and again. Okay, and that's cranial nerve 11. Also, while we're talking to Heath, we're going to be assessing his mood, and we would be listening for his voice and articulation, and that is cranial nerve 5, 7, 9, and 12. Moving on, we would have Heath, obviously his shirt would be off, and to look at the thorax, we would just watch Heath breathe naturally. We would make note of his AP comparison. It should be a 1-to-2 ratio. Any like barrel test or anything like that could be emphysema. We would make note of his skin. Is it the same color that the rest of his body is? Are there any open wounds? Are there any pulls? Is he using his accessory muscles while he moves? We would look at the front and back, make a note of the skin and the use of accessory muscles and things like that. Now that we've looked his chest over, we're going to touch his chest, and we're going to start at the back. So Heath, just swing your legs this way for me. There. Heath, I'm going to have you say 99. This is tactile fremitus. Okay.
99.
Okay, so I could equally fill that throughout. I'm also going to go down to about 10th intercostal space. I'm going to have Heath inhale and exhale. Okay, Heath, can you also cross your arms in front of me? Thank you. So for this next percussion, what we're going to do is we're going to percuss down. I'm going to have Heath inhale. Inhale and hold it. Did you do it? Oh, sorry. And we're going to palpate down till we feel dullness. Okay, let that out. Go ahead and take a breath. And now do the same, but leave your breath out like. Okay? Can you do that for me? And hold it. Okay? And that's the excursion, and what we would do is we would measure it, and it should be about 3 to 4 inches in difference. 3 to 4 centimeters. And it is. So that's good. Then going to move on to feeling, and we're going to feel for any lumps. We're going to feel in the intercostal spaces, and we're going to, Heath, if you feel any tenderness, you just please let me know. And we're just going to feel from side to side, making sure there's no lumps that we feel, anything like that. Again, Heath wouldn't have a shirt on. We would have already looked at the skin. Going to just percuss, I'm sorry. this would mean consolidation, and there's not any. I'm also gonna go ahead and check for the CVA tenderness, Heath. You tell me if there's any tenderness. This could mean kidney infection if there were any pain. We go down the midline and then go down the 12th intercostal space. I'm gonna hit the back of my hand. Any pain?
No. No.
Okay, now we're just gonna listen, then we'll go back to the front. Just inhale and exhale for me, okay? Go side to side. In a normal setting, you would listen for a full inspiration, expiration. You can sit forward for me. Okay, we're going to do the same thing again. We would have already looked at the skin. We're going to palpate, feeling in those intercostal spaces, feeling for any lumps or bumps. We can also feel the cardiac points, aorta, pulmonic, herbs, tricuspid, and mitral. You can also over here feel the apical pulse. But again, we're just feeling. This is just feeling. I don't feel anything. We would also have him do hypermesis and 99 for me. Say 99 for me.
99. 99. 99.
Okay. Good to also percuss. Gonna listen to the lungs with the diaphragm. The supraclavicular line is where you're gonna hear the apex best. So Heath, I'm gonna have you take a deep breath for me. And then you would move down to your second intercostal space, and you would move in a zigzag method, going in between each intercostal space until you got to the bottom of the base of the lung. And we know that right side has 3 and left side has 2. Let's keep. Awesome. Moving on, we're going to look at the cardiac system, and we will listen to his lungs, but one part of the cardiac assessment is you're going to feel all the pulses throughout, and you're also going to look for the skin. You're going to note the color, the temperature, is there any edema, capillary refills, and things like that. So we're going to feel the temporal pulses and the carotid. The carotid you would do one at a time. And we're going to listen to both of those, and we're going to listen with the bell because we're going to listen for bruits. That would be an abnormal bell. Okay, so that was carotid and temporal. We're going to move on to the brachial. So these are +3 regular. They're good pulses, regular equal. +3 equal. Going to go ahead and fill up his cap refills. And they are less than 3, and that's a good amount. Also, I don't know any edema in his upper arms. I also don't know any lumps and bumps. That'd be a good time just to feel and see if there's any bumps in his shoulders, his arms that we need to make a note of. There's not. The skin feels warm. It's not clammy, anything like that. Move on to femoral pulses would be right here, but for the purposes of this video, we won't feel those. We're going to do popliteal. Again, we would do this bilaterally. Tibialis. And then dorsal pedis. Again, make a note, is there any lumps or bumps that we need to make a note of? The skin is normal throughout. The color, also look at the color, like are his feet blue? That would mean there were some issues there. There's no edema. If there would, you would grade it 1, 2, and so forth. Pitting, non-pitting, is it weeping? His color's appropriate throughout. There's no lesions to note. Hair is equally distributed throughout the arms and legs and torso and whatnot. Okay. I'm going to move on to listening, and you will listen with the bell and the diaphragm. For cardiac, you listen to all 4 points, sitting up and laying down. We'll do the laying down in a minute, and we'll also check for JVD in a minute. So diaphragm, aorta, pulmonic, tricuspid, and mitral. That's an awkward thing. And like I said, you could feel the apical pulse, and you'll flip and you'll do the bell. Aortic, pulmonic, Erb's point, tricuspid, and then mitral. Okay, I'm gonna have you lay down. This is just our scribbles and vital signs. So for the purposes of this video, when we are checking for JVD in a clinical setting, we would have the patient at a 45-degree angle. We would have the patient turn his head, and we would note any bulging or anything like that, pulsation to that JVD, and we would do it bilaterally. We're going to move on to continuing to listen while the patient's laying down. We're going to listen to our 5 points of the cardiac with both the diaphragm and the bell. While the patient's laying down, we're going to look at breast, abdomen, and the genital region. For the breast, we would have the patient, we would assess in 2 positions. You can do standing with the arms together, or leaning over in a chair, or laying down with the arm above the head. You would look at the skin. You would note any lumps or bumps that you can see with your eyes. You would note nipple inversion or indentation, any dimpling of the skin, retraction of the nipple, that's the word I was looking for. The color, if there any drainage coming, and you would do this in both male and female. So people forget about the male, but they also need to be assessed. You would, when you palpate, you would palpate from, you could do in a circular motion, outward, inward out, or you could do up and down, as long as you're just consistently going throughout. And you would also feel a tail of Spence underneath the arms into the axillary, and that's where nodules can also be felt. And you would be looking for hard, fixed nodules that could be malignant. You would also look at the genital area. For a man, you would be looking at hair distribution. You would be looking at, are there any lesions that could be, an STI, scrotum, the urethra. If he were to have a uncircumcised, you would retract that and make sure everything's where it's supposed to be. We'd know if one side bigger than the other, and then palpate again for lumps that could mean any like cancer or anything like that. We'll do that to both male and females. You would of course need a speculum for a woman. For the abdomen, Heath, will you lift your shirt for me? You are going to look at the curvature of the stomach. Before you touch, you're going to look at the curvature. Is that umbilicus midline? Do you see paralysis or pulsations that we need to make note of? Is it equal to both sides? What does that skin look like? Of course, you always look at the skin no matter what you're doing. Does everything look equal? Then for the abdomen, you're going to listen before you touch. So you're listening at all 4 quadrants, and you also would listen to the iliac and renal kidney, not kidneys, the aorta, the iliac, and the femoral. Listening for bruise. We're just going to listen to the aorta, and when we palpate, you would do inguinal nodes, which would be horizontal and vertical, but for the purpose of this video, we will not. So we're going to listen with the bell, diaphragm. Okay, and he's got active vowel sounds times 4 quads. We would then percuss. There would be a dullness over, it could be the liver or the spleen, or the kidneys are in the back. When we palpate, light palpation, you might want to feel over that renal, that aorta, The light palpation is looking for any bumps, Does he have any tenderness? Because if you already feel tenderness upon light palpation, you might want to maybe not need to do deep palpation where you'd want to feel for any inflammation of the livers or anything like that. So with the liver, you would go down a midclavicular line, and you would start when you feel it and come down to the end. You could come back and push that. Sometimes you can push it. Sometimes it's not an abnormal finding not to feel the liver, but it would be about 7 to 8 centimeters where you would measure for that. No rebound tenderness and deep palpation. Any pain?
No.
Okay. We can also feel to see if there's any reaction. There is. His stomach moved. Okay, that's normal. You can pull this down. We've already felt his shoulders, arms, and legs. I'm a feel of his hips. Okay, I'll feel. Heath, can you push your leg out for me? Cross it over. Raise it. Okay, bring it down. Again, can you push it out? Okay, that's 5 out of 5. In. 5 out of 5. Awesome. While he's laying down, we're going to do the Babinski test. He shouldn't have any flaring of the toes. Heath is very ticklish, so he might have a reaction. Sorry. Okay, yeah, that's a deep tendon reflex. Making sure we didn't miss anything while we're laying down. You can sit up for me. Okay. Can you, we'll go ahead and do your, let's sit back in the chair for this. So he gets some leverage. Okay, we're going to test his deep tendon. So we're going to do, hang your arm for me. Tricep. Bicep. Brachioradial. Patellar. And then Achilles. Okay, those are all normal findings. Heath, I'm going to have you raise your arms, drop your arms, cross them in your front. Bring them back behind you. Awesome. Do like this, like we practice. Pull up, pull down. Okay, that's 5 out of 5 strength. Squeeze for me. Again, you would do this bilaterally, but for the purpose of this video, we will not. Can you put your leg out, in, put your foot like this for me, in, out, spread your toes, close your toes, in, up, no, like this. Okay, yeah, both, okay. Do your hands, spread your fingers, close your fingers, in, up, in, out, okay. Do your hands like this, let me touch your shin, pull, separate, okay, 5 out of 5. Gonna have you stand up for me. Can you bend forward for me? And now back, all the way, okay. Can you rotate for me? And then, can you walk to me, just normally? And back, heel toe. Oh my goodness. And then to me on your tiptoes. Okay, go back, we're gonna do your lumbar test. All right, close your eyes for me. Put your arms out in front of you. And you would know any drift, and there's not any. Okay, you can have a seat for me. Close your eyes. Put this in your hand. Tell me what you feel.
Paperclip.
Okay. Keep your eyes closed. Tell me what letter I'm drawing.
In.
Okay. Keep your eyes closed. Tell me what you smell.
Peppermint.
That's cranial nerve 1.
And
sorry. Tell me what you feel.
I don't know, something soft.
Okay. You just tell me if it's soft or hard. I'm sorry.
Hard.
I'm sorry.
Hard.
It's
Soft.
just like we practiced.
Hard. Soft. Hard. Soft. Hard. Soft. Hard. Soft.
You can open your eyes now. Trying to make sure I didn't leave anything. There's something I'm missing. We checked all your muscles. Out and out. Did you bend your knees?
I think so.
And did this, and we did it against resistance too. Okay, we're done.